now. For anyone that can't join us for the full 60 minutes, I'll make sure that you do get a copy of this later on. It'll be hosted on the YouTube channel and across a couple of our social platforms. Right, so a couple of things before I hand over to Tracy, our director. A couple of house rules, if I may. There we go. So if you could mute your microphones during the session, we've got the Q&A function. So if you look at your Teams window in front of you, you've got the Q&A button there. You can drop any questions throughout today's webinar there. We will come to them towards the end. We'll pick a handful just to maybe discuss, but I will say that we'll come back with answers to all of your questions probably after the session there. So you'll be able to check back if you've got any sort of key questions there. Do use that function. We're on social media, so again, hashtag GwentJSA, and if you're on X or Twitter, whichever way you want to go there, do tags in Naira Bevan University Health Board. So in terms of what we're going to cover today, Tracy is going to give you an overview of the Gwent Joint Strategic Assessment. We're then going to have a live demonstration of the tool and how to use the tool from our health intelligence team. That's James Atwood and Simon Hodgson. And again, we've got a bit of time for Q&A then at the end. So I'm going to hand over now to Tracy Deskovich, our Director for Public Health, just to give you a bit more of a background.
Thank you very much, Scott, and a very warm welcome to all of you on the call. Thank you very much for giving up time to join us this morning. We're very excited to share this with you. The Joint Strategic Assessment has been 6 months in the making. It's an opportunity where we have pulled together data and intelligence that we have available to us across Gwent, and to build it into a single version of the tell the story of our fabulous community, highlighting some of the needs of the ways that we can prioritise for our community in terms of reaching them more inclusively over the past, to deliver our priorities around tackling inequalities across Gwent. So I hope you'll enjoy the demonstration. Like Scott has said, there'll be opportunity at the end to share questions and ideas and to really engage in this process. And today's is the launch of the platform, but there'll be lots of opportunities to get involved and really start and build on this. So this is very much the foundation conversation. So a very warm welcome to you. I'm going to hand over to James and Simon because the important bit is to see the tool. So thank you all ever so much for joining us, and I hope you enjoy the demonstration for the next hour. Thanks all.
Okay, good morning everybody. My name is James Atwood. I'm a health intelligence consultant here in the public health team in Naira Bevan University Health Board. I am going to be taking you through the structure of the Gwent JSA and showing you some of the slide decks. So firstly, before we get into the slide deck, like Tracy said, the purpose of this is to get a flavour for the health and well-being of our population within Gwent. The way we've structured this is across 6 different themes, which all have their own slide decks. Within that, what we've tried to do is we've tried to look at how Gwent compares to Wales nationally, but also within Gwent, down to the local authority level, how do they compare to each other? We know that that only tells us some of the story, and actually one size doesn't fit all. So there will be pockets within those different geographical areas with different levels of deprivation, life expectancy, etc. But the purpose of this is really to get that flavour for the Gwent population. So the first thing I'm going to do is share my screen. And hopefully you can see a graphic with some hexagons on.
We can see that.
Great, okay, so these are the 6 different themes that we've decided on this year. Each of them on the summary page, when you click on it, it will give you a very brief overview of the key messages from that theme. And then you have the ability to click into the slide deck to see more information. So I think Scott is going to do a bit of a poll about which of the themes people would be most interested to see. While we're doing that, I am going to go into the housing crime and the environment theme, just to show you what this looks like. So into the housing, crime and environment theme, the first slide we've got is children in low-income families, and this demonstrates a structure of a lot of the slides that are in the slide decks. So what we have is a couple of visualizations. We have a chart. We have how Wales and Gwent compare to each other. That's over time. And this is percentage of children aged under 16 in relative low-income families in Gwent. Now, the first thing we've got is a definition of what that means. We've got what the consequences of living in low-income families would be. A caveat around some of the data. And then just describing what the chart says for the audience to make sure that they're sure they're reading the right thing and they're interpreting it correctly. So it just reassures them and tells them the percentages. There are a lot of slide decks, so we're not going to go through every single slide in detail. We would be here for quite a long time, but when this gets sent out, obviously people can explore this and spend their time digging into the things they're most interested in. So just taking this slide to start with, we can see that the percentage of children aged under 16 in relative low-income families in Gwent is higher than that in Wales for the past few years. In the most recent year, 22.7 compared to 22.1. And again, up here, we'll tell you the consequences for children living in low-income families. So we know the health and well-being. Health is a portion of that, but there are a lot of other wider determinants and factors that contribute to people's health and well-being. The next slide we go on to, as I talked about, breaks that down into a further geographical area. In some of the other slides, so in diseases and ill health, which is a different slide deck, we go down to the primary care clusters, the GP clusters. In a lot of the other slides, we go down to the 5 local authorities within Gwent, and we look at how they're doing. So we have the view of Wales and Gwent, but then what does that mean internally within Gwent? We know that, for example, in Blaenau Gwent, if we looked within Blaenau Gwent, there may be a spread around that as well. So we can see the percentage of children aged 16 in relatively low-income families by Gwent local authority, 27.4% in Blaenau Gwent, all the way down to 15.6% in Monmouthshire. So despite on the previous slide, we saw that it was 22.7 in Gwent overall, we know that actually that's spread geographically. One size doesn't fit all. There are different communities with different challenges. The next one we've got is we're looking at the ratio of median house price to median gross annual resident-based earnings, and this is a measure of affordability. Obviously, if house prices are going up very quickly and earnings are not, buying a house becomes a lot more less affordable. So again, we have the same theme, Wales versus Gwent. The time series, what that's been like over time, and more recently, the last couple of years. Where this gets interesting is on the next slide, where we've tried to build some visualizations in that can also engage the audience. And the idea with this is that we have all of the areas on a chart, but we know that different people for different purposes might want to have a look at particular areas. So if you just wanted to look at, say, care filling, you can have a look at that, and you might want to compare that to Newport. And again, you have the ability to fully customize what it is you're interested in looking at. It might be Gwent versus Blaenau Gwent. Again, gives you the ability to customize depending on what you are interested in and why. On the right-hand side, there's also some description about what you're seeing and about the relative affordability. This chart is really quite hard-hitting. So on the top left, we've got in the gold, the median house price, and in the blue, resident-based earnings. So obviously you can see how quickly the gold chart is going up and the blue chart is staying quite steady, rising much less. That means that house prices are going up much faster than salary. And again, that is a proxy for affordability for people buying houses. Just to add some context around that to the reader, is the interest rate on a fixed rate mortgage, which for so long has been very low, around 2%, making again affordability. But in the last year and a half, we've seen those interest rates go up. And that has implications for first-time buyers trying to get rates, but also people coming off fixed rates who are trying to negotiate new fixed rates or variable rates. The repayments over here, it will illustrate how much that will have to go up. Going into a bit more around the house prices and earnings, we've got the house prices and the earnings on the same chart. And again, this is fully customizable. So if we go to Monmouthshire earnings, Monmouthshire house price, again, we can compare the two local authorities across those two measures as a gauge for affordability. And we can do that for Blaenau Gwent, and we can see there's a really steep rise in the house price for Blaenau Gwent, but the earnings have been quite flat, again, making this less affordable. If you wanted to just look at the earnings in different places, again, you have the ability to do that. Then you can see how the earnings have changed. Of note, there was a big gap between Blaenau Gwent and Newport and Caerphilly. That gap has closed in recent years. Newport seems to be rising ahead. So direction of travel is as important as where we currently are. I'll go into a couple more slides and then I'll take a view on whichever slide deck you want to go into next. So we have some information here on people living in material deprivation and some households successfully prevented from homelessness. We have some definitions of what those mean and some implications on the effect to the population. The last one on this one we'll have a look at is by housing tenure. And again, this shows you the different levels of ownership by year. There are plenty more slides in the housing one. I'll quickly just flip through housing, crime and environment. So there are some slides on first-time offenders, some crimes, some reoffences. And again, we have that by Gwent, we have that by age band, we have that by local authority. And again, this is to give you an idea at the Gwent level, how that compares to nationally, but also locally, how do we compare within Gwent across the different areas? Again, appreciating there will be different levels within these areas as well. So that's the first slide deck that I was going to show you. I will show you a second slide deck of the 6, which has been voted as diseases and ill health. So I will go into the diseases and ill health. And again, if you have any questions on the housing slide deck, please pop them in the chat for at the end of the session. So the first slide in the diseases and ill health looks at the disease prevalence. The disease prevalence is found by the GP practice register, disease register from primary care. And again, what we have is a list of diseases, the prevalence rate within Gwent, and the prevalence rate in Wales. And what we can do just from this is see a couple of things. So the first thing is the level of prevalence rate of how different diseases compare to each other. So we can see hypertension is much more prevalent in a population than dementia. But we can also see there are some, you can notice from this, where the rate for Gwent, the prevalence rate for Gwent is higher than that for Wales. So again, it leads you to the question of why is that? Where is that and why is that? So that informs us about what we can start digging into locally to see if we can see why that's happening and what we can do about it. So the next slide will just detail that in a bit more. So we zero in on two things that we can see where the Gwent rate, based on the infographic, is much higher than the rate for Wales. The Gwent rate is the blue dot and the Welsh rate is the gold dot. So we can see straight away for both obesity and diabetes, the rates in Gwent are higher than they are in Wales. And again, this will start informing strategy about looking into that. Why is that? Do we need to change some behaviours? Do we need to put some interventions in place? Do we have to have a look at what's causing that, what are the drivers in that, because some of those things that we will find here will have consequences, probably negatively in a lot of these instances, for the health and well-being of the population, which we want to improve. We then take each of those diseases individually and we have a look at what that means. And again, like I said before, on the diseases and ill health slide, we have the Gwent versus Wales over the past 3 years, which has been quite static. But we can also have a look at the NCN, which is the primary care cluster, the GP clusters across the different areas, to see the prevalence rates within those different clusters. And again, that gives us the ability to see where within the area some of these high rates are, we're finding them. Hypertension is the next one, very similar story. I'm going to click through quite quickly to a couple of the interesting ones. So on this one, this is quite an interesting one. The dementia slides, we saw the prevalence rate compared to other diseases is quite low. And we can see on the right-hand side that actually the prevalence rate in Monmouthshire for North and South is higher than in the other GP clusters. So some people might think, well, are you more likely to get dementia if you live in Monmouthshire? Well, actually, Monmouthshire has a more elderly aging population, and dementia is more prevalent in older ages. So that would explain a lot of what that is. So it's very important that you infer the right things from the data that's there. And again, that will be covered in the narrative that is around the slide deck. I'll move us through to some of the other slide decks that are a bit more interactive. So this is cancer, so all malignancies, excluding non-melanoma skin cancer. And we have this by Wales, we have it by Gwent and the local authorities. And again, this gives us the ability to customise depending on what you want to have a look at. So it may be that you want to see carefully against Gwent. Then you can have a look at the trend. And like I said earlier, where we are currently is important, but also the direction of travel. So we can see that the rate for Monmouthshire is lower than carefully in Gwent. It's starting to increase after years of declining. So it might be something that we're looking at to see how do we manage to decrease it? How do we decrease it again? There's a similar by age band. So we split this by gender and age band. And again, this gives us a little bit of a further insight into cancer incidence by the gender and by the age group. We then go into some of the particular cancers. So we've got breast cancer. Again, the interactive slide deck, prostate cancer with the slide deck, lung cancer, colorectal, cervical cancer. And then what we've done is to try and make this as useful to the audience as possible. We've put all the cancers onto one slide and given the user, the audience, the ability to filter if you just want to look at a particular cancer. So it may be that we're looking at colorectal cancer, and then you might be looking at Gwent, Newport, and how that compares to Wales. So again, the user has the ability to dig into all of these things and customize the use depending on what they're interested in. The next set of slides within this slide deck is on vaccinations. So we've got 3 different types of vaccinations that we've used. There are lots of other vaccinations things we could use. So deciding on the content for the Gwent JSA, there are hundreds, probably thousands of indicators that we could use. We've decided on using things that we think are useful and relevant for our first iteration. But each year, as Simon will discuss later, we will review what's in there and make sure that we're trying to publish all of the measures and indicators that we think are relevant and valid for that time, which will change over time as priorities change. So this one is the 6-in-1 vaccine. We've got the 4-in-1 preschool booster, and we've got the MMR vaccine. So people will be aware of measles outbreaks, probably locally, certainly within Wales. And again, this shows you there's been a decline in a lot of the vaccinations. So those two things start adding up, start telling a story that makes us think actually we need to be doing something and changing this direction of travel. So on that note, what I'm going to do now is change from slide decks, of which there are 6. Another way we have decided it would be really useful to represent the intelligence that we have is through what we call a life course. And the way we've done that, I will show you now, is we've represented not all of the measures that are in the slide deck, but some of the ones that we think fit into a life course. And this is aimed at telling a story through the journey of life and giving you some of those key measures around particular points in life from birth, preconception through birth, teenage years, working age, and older people. There are some of these slides that, some of these figures that we felt were more hard hitting if we put the numbers in instead of the percentages. But again, it will tell you that story about the life course through life. And we know that probably different people have different life courses depending on deprivation, opportunities, equality. So this is just an overview this year. In future years, we may show you different people's journeys through life. We think this gives another take and another way of visualizing the intelligence that's in the Gwent JSA. And again, as many people we can engage and start telling some of these key figures around vaccination rate, numbers of suicides, how long people are living for, how long people are living for healthy. So healthy life is what we want to give people, not necessarily just a long life. We want to make that life as healthy for as long as possible. So in terms of the slide decks and the life course graphic, that's where I will finish. And like I said, if you have any questions related to any of those, pop them in the chat and we can try and pick them up at the end. And if we don't have time, what we'll do is we'll take all of those questions and get back to you. I'm going to hand over now to my colleague, Simon Hodgson, who's going to talk to you about the future of the Gwent JSA.
We've been playing musical chairs in here. Get seated and comfy. What I'm going to do first is just double check that everybody has the link to the public facing website. I'll just find it for you guys and put it in. Share the content on there. Right. Okay. Where we need hold music. Stop sharing the screen.
Just while Simon's loading that, then I've dropped the link back in just to remind you all, it was on the diary marker, but that is the web link where you'll see a lot of this content hosted on the Health Board website.
Nearly there. Okay. Screen again. This is the public-facing link to Gwent JSA or Joint Strategic Assessment. It's got the similar look and feel as to what James was mentioning further down on the screen. So a bit of blurb at the beginning, and then it loads each of the chapters or sections top, and further down it's got that similar hexagon or flower shape where you press a button and it will bring up each of those individual chapters and you go in detail on it. Loads. Takes a bit of time to load, but it will load. And yeah, that one's quite a good one because it's got an interactive movement to it, which I really like that one. Took quite a while to create as well. So I'll stop sharing my screen because I'm mainly here to talk about the future of the Gwent JSA. So we've developed this initial run at the Gwent JSA, the first one of its kind, and we're aiming to do this on an annual basis and improve every year with your feedback so that we can make it better each time. with an aim to add in more metrics each time, change up the presentation style so that it works best for everybody, particularly in the next one. We're thinking of providing a more focus on the local authorities so that there's a bit more easier detail and easier to pull out the local authority story in each bit, and also change the format of the presentation. So potentially moving to a video format for the next one, so that it's a bit more easy access to the data. Oh, sorry, I'm speaking too quietly. But yeah, so that there's more of a video format, an interactive nature to it, and coming out a lot more and engaging with you all about how the indicators can be made up and getting more indicators in here. I think that's all of our presentation, and now it's to the questions.
So we've got a couple of questions which I'll drop into now. So no particular order, in the cancer data section, does it capture screening uptake, such as cytology, mammograms?
It doesn't in this year. We found the screening data really difficult to get hold of, but it's something that we definitely want to try and explore to get in there for future years.
Brilliant, thank you so much. We have another question here. So again, just to remind you all, there's a Q&A tab along the top if you want to drop your questions in. In the life course, why is there no indicators for breastfeeding, given it has impacts on mental health and future obesity?
Yeah, I think that's a really good question. I think this year was to try and get some of the kind of the really basic key stuff in there. I think it's probably something that we know we want to include in future iterations. This year, we were up against time, basically, trying to find all of the data for the first time. The data is not easy to find for all of these things. Now we have that. We know that we can refresh these quite quickly in future years and spend more time trying to source the data for other things. And we will be trying to engage with people, like Simon said, about what do you think should be included in future years and why, with a view to almost kind of supporting strategically some of the local partners, some of the public health team. We know this is a drop in the ocean, but absolutely going forward, we're going to be looking for people's views around some of the other things we should be included that are probably really vital.
Thanks, James. So obviously we want a lot of people to use this data. So a really good question here is, how do people best reference when using this data?
In every data pack, at the very back, there are references to the direct sources that we've taken. So if you did want to go to the source, you could reference from the source. But also, if you wanted to reference the Gwent JSA, I often reference via the web links whenever I'm referencing, so that people can go direct to the source of that bit if you did want to use the Gwent JSA as the reference rather than the initial source data in there. James is just showing the back page.
Yeah, so all the data sources are the last slides in the slide decks, which I will get to. So, for example, each of those different themes within themes, if you like, will have a link to the data source, which may cover multiple slides, and people can go to those if they want and see the data that we've used. Or if you have any questions, we can tell you in more detail, send you Excel files or charts around some of this data we've downloaded. Some of it is just figures you can use. Some of it is big data sets that you have to then query and analyze to get out what you're looking for. So rather than people doing all of that, they're welcome to do that if they want, or they can come to us and we can tell them the source of the data and how we manipulated that to get the figures. I think also, just to share, because we haven't, I don't think, mentioned it yet, but we are working on a Welsh version for this, which will be exactly the same, all of the slides, all of the visualizations, everything within the visualizations. So the legends, the keys, the prompts around click here to show are being translated into Welsh. So there will be a Welsh version as well to try and engage even more of the audience.
Brilliant, thanks, James. And yeah, just to touch on the Welsh as well. So the translation's just about finished. It will be live on the platform within the next 7 days. And I'll make sure you've got a copy of both of those. At the moment, this is an early access for partners. This will be going out to the public then over the coming weeks. A few more questions, if I may. So, for cancers, could future iterations include forward projections on prevalence to help inform service planning?
A lot of when we're doing the JSA, we're picking data sets that already exist. So if those projections already exist, that will be an easy thing for us to add in to a Gwent JSA. If it is that we'd have to create those projections, that will have to be a discussion at that time as to whether it is possible to create with enough certainty that we have it. But if those already exist, then yeah, we could have a discussion about putting those in.
And I think just to add to that as well, we've already had discussions with primary care colleagues and planning colleagues this week around future prevalence rates to look at, you know, how the population disease prevalence is going to evolve in the future. None of that is in exact science, but we can start looking at the things like the change in population over time and how there's going to be more people over 65 and 85, which is going to have an impact on the needs and the services. And therefore, you know, what do we need to do as an area, as a health board, as a local authority, as a group together to look at those services and provision for the population going forward. So we're already looking at that. Maybe, as Simon said, it may be incorporated into future JSAs. If it isn't, it will probably be part of the intelligence function that we do to support partners and colleagues here.
Brilliant, thanks so much, James. Another question here, are there any plans for understanding the key measures affecting healthy life expectancy in any of the geographical areas such as local authority or NCN areas?
So I would say, yes, the whole purpose of this is to kind of say the what, and this highlights issues, particular things within Gwent or within local authorities or within the NCNs, but that isn't any good if you don't do anything about it or it doesn't inform your strategy. So a lot of this is derived at pointing people in the right direction to start asking questions. If people in Monmouthshire are living a lot longer than people in Gwent, for example, why? You know, we need to dig into that. And is it across all of Monmouthshire? Or actually, are there deprived areas in Monmouthshire that are also not living very long? And if so, what do we do about it? We have a finite set of resources. How do we best utilise those resources to improve that healthy life expectancy? So I see the JSA as something that informs strategy, but absolutely the conversation should be based on some of these figures. What do we do? How do we find out which people this is to do something about it to improve that?
Brilliant, thanks so much, James. Do we know if this has been replicated in other health board areas across Wales?
So my understanding, and I may be wrong, but my understanding is that this hasn't been done in Wales before. So I think we are probably the first people to have done certainly something that brings everything together in a holistic way for the entire population. There will be particular themes and strategies and areas of work and services that probably use a lot of the same data sources for their needs assessments. I'm not aware of anything, unless anyone else is, of any other health boards where they brought all of their main data sets together to give a complete comprehensive overview. Even though we know we can go into thousands more indicators, this year we've got, I think, 150. I don't think that's been done in Wales as yet. So if that hasn't, and people find this really useful, which we do, I'm hoping that we can inspire other health boards to do the same. And if we do, and they want to have a conversation, then we can certainly, you know, provide support to them, tell them how we did it, and hopefully we'll have a benefit in their area.
Brilliant, thanks so much, James. The change in population over time would be really helpful for 5 to 10 years in service planning. So I guess in our next iteration, definitely wider things for us to consider on that one. I'm just going to scan through so I can see any more. And thank you so much for your kind comments as well, everyone. It's really appreciated. I'm just going to check the Q&A tab as well. Breastfeeding. So I've got a question. Do you intend to look at smaller areas within local authorities? I think we've probably answered that with the NCN sort of looking a bit wider there in terms of breaking down geographical areas.
Yeah, I think just probably to add to that, there's only a level of detail you can go to with some of this data when it gets published. So we try and go down to some of the lowest areas. There is data that gets published that goes down to what's called a lower super output area, which is a small geographical area. That for a lot of these measures is difficult to get below what we've got here. But we feel it's really important for us to understand our local population in greater detail rather than just by local authority or by Gwent. And so we are developing our local intelligence function to be able to look at some of the whys and wheres down to lower super output area or postcode to understand in greater detail the population.
Brilliant. Thanks so much, James. Just looking around, I think that is all the questions unless I've missed them. And again, just feel free to drop me if you've got any more questions. What I am going to do, everyone, if it's okay, I'm going to drop Simon and James's email into the chat. So you may go away, you may have some further thoughts, questions, you may want to know more, you may want to delve into areas of the platform and have a further conversation. So I'm going to drop James and Simon's email in the chat. So in terms of next step, following on from today, this webinar is going to be available. I'll make sure you get a copy of the link. Over the next week, the Welsh version of the JSA will be live on the website. And again, I'll make sure you get a copy of that. Next steps and things you could do to support us. Share this across your organization, share it widely internally. There's a lot of areas of benefit. It doesn't matter what area you work in, whether it's planning, finance, operation, comms, the list is endless. This is a great tool that could really be used for a multi variety of ways. So we'll share it with you. It will be going live to the public over the next few weeks as well. So you may see some public activity. We'll make sure you keep in the loop. As Simon said, there is an ongoing work plan for this. There will be future versions of this because obviously data doesn't stand still. We've got to make sure that we keep telling the story here across Gwent. So we will use anyone that's subscribed here today to keep you up to date on future activity and events. But can I just say a massive thank you to James and Simon and Tracy for all the hard work that's gone into this through our health intelligence and our public health team in Gwent. And can I just thank all the attendees today for taking the time out to come and listen to the demonstration. And again, do keep in touch with us. This is only the start of the conversation. So thank you so much, everyone. I wish you a very great rest of the day, and I'm sure we'll all be in touch again soon. Thank you, everyone.
Thank you. Bye-bye.
Thank you.